kind of thought while I was sitting there feeling a little bit uncomfortable, but the procedure really wasn't that bad. The whole thing wasn't as bad as I thought it would be. And I thought, well, if I can manage this and it hasn't completely upended my life, why wouldn't I think about giving someone some of my eggs?
Hi everyone, and welcome back to No Place Like Home. I'm your host Larissa, and today I am joined by Jess. Hi Jess.
Hello.
Hello. We're going to talk an interesting topic today. Well, I certainly found it interesting when Rach told me we were going to talk to you. First of all, tell us a bit about yourself. So background, work, family.
Yeah. So at the moment I'm 34. I'm a nurse and have been for about 13 years, and I'm also a paramedic and have been for 8 years, and I'm just about to start my role as a flight paramedic this year.
Oh, like a flying doctor's?
Yeah, in the aeroplanes and things, retrieving people from areas of the state and
Oh my God.
around Australia as well.
Incredible. So, okay, our topic today is about freezing your eggs. And so I think this topic intrigued me because we talk about sperm donation like it's like everyone knows it. It can be the butt of some jokes. It can it's a lot more common knowledge, sperm donation, than egg donation. And I would like to think that that is because it's a highly detailed much more intricate retrieval process, aside from the obvious. I'm not going to go into the details of sperm donation. We can all paint a picture. So where did this start? So when did you start considering freezing your eggs, and why, I suppose?
So I have a long history with endometriosis and polycystic ovarian syndrome. I haven't suffered too severely with it. I've been able to live relatively normally and had a few surgeries along the way, a couple of cysts and things. But it had always been in the back of my mind that I might need some extra help to get pregnant one day if I do start a family.
Right.
As I got towards the end of my 20s, I started thinking about it more and more, because I had that image that lots of young women have in their head, that by the time they're 30, they've settled down, they've got the kids, everything, what society kind of expects of us, as well as our career. And I started investigating it then. I got to my early 30s, 31, and ended up with appendicitis and had surgery for that, which was fine, all went well. And the surgeon said to me, it might be worth going and seeing a proactive gynecologist because you had some endometriosis around your fallopian tubes, which can cause the egg not to be able to travel down the tube into the uterus, so to be able to fall pregnant naturally. Whereas freezing the eggs, they'd be able to implant it straight into the uterus and they'll be there and available.
Instead of it going through.
And they didn't say that the tube was blocked, but there was the potential. So they just thought it's worth investigating it now while my eggs are young and healthy, rather than waiting for a few years down the track.
Okay.
So I went and saw my GP. It was a bit of a tough conversation. It was a bit teary because I always thought, I'll have a family and I'll be doing this with someone else. But she was really supportive. She's a women's health GP and she really looked after me. And she referred me to Dr. Aurelia Liu at Women's Health Melbourne.
Oh, yes.
And, booked an appointment with her, and that's where the process started.
Okay, so what were your expectations going into this? Did you have some sort of story in your head of how this was going to go, or do you and also based on your qualifications and experience being a nurse within the system, did you have any expectations going into it?
I had some idea or some expectation, but mostly based on what I'd seen in social media or had seen my friends go through. And the whole process really opened up my eyes about how little we know about women's reproductive health as even healthcare professionals, let alone the general public. So once I started seeing Dr. Lou and the nurses there, I ended up having a lot more questions than I thought I would going into it.
Right.
So they were very helpful though. And I guess my expectation was I'd hoped for a couple of eggs. With my history, I was a bit concerned that they wouldn't get many, and it's a big financial obligation.
Yeah.
It's quite expensive, and there's not really any subsidies available for, and there's very, very strict criteria around when you can receive subsidies or Medicare funding. So
Wow.
I was really hoping to just get a few really healthy eggs to hopefully guarantee me to be able to have a family one day. That was my main expectation, or main hope to going into it.
Of course, yeah. What were your main questions at the time?
My main concerns were around the injections that I was going to be giving myself. I was very comfortable administering them, but I was concerned about the side effects and how they would affect me as a person and my mental health as well, going into hearing more and more now about postpartum psychosis and postpartum depression and all the issues that can arise during pregnancy. I have had anxiety on and off through my life and been medicated for that, and I was a little bit concerned that these injections would, ramp up all my hormones and throw everything out of whack, and that I was going to have this horrible spiral. So I had lots of questions for Dr. Lou regarding that, and I also had to see a psychologist anyway before I did the retrieval.
As part of the qualification of being able to do it?
Yeah, just for my own retrieval, I still had to see a psychologist, and they were very supportive and linked me in with someone within my community as well. So I had lots of support, and there was actually no real side effects in that regard, so I was safe in the end.
That's good.
But that was my main concern, was how it was going to affect me mentally and what kind of person I would be like around my friends and family, and if I'd still be able to do my job and if it was worth it.
Yeah, absolutely. So what did that process look like for you?
Yeah, so once I got the referral for Dr. Lou, I had to do some screening and some investigations, which just included general health and sexual health, reproductive health. So a full STI type screen, virology to make sure that I didn't have any other infectious diseases that may cause genetic issues down the track with the eggs. I had some imaging done, some ultrasounds, and then a physical examination. And I also had to be signed off by the psychologist and speak to the nurse as well. And then once that was all done, on day 3 of my period, we start the injections, and it's 1 injection a day at the same time every day. And then about day 6 or 8, you start doing 2 injections a day. Then just before you go in, then a few days after that, you go in for an ultrasound. They have a look at how many mature follicles you have. Right. And then if they're of adequate size and that the egg inside will be mature, they send you home to have the trigger injection, which you take, and then it's normally 2 needles, and then in the morning the next day you need to be in theatre within, I believe, 12 to 24 hours, because that triggers the final maturation. Right. And if you don't make it into theatre within that time frame, that all the eggs can be released into your fallopian tubes and uterus, and they're all gone. So it's very time sensitive.
How long was that process in terms of you starting and then the actual egg retrieval?
For me, it was about 6 months, but I shuffled it around my work schedule. I wanted to make sure that I was available, or I was able to do the injections at the same time every day, and that I was very careful with it, and that I didn't know how I'd fare after having the procedure. So I wanted to make sure that I wasn't pressured to go back to work. So it took about 6 months, but I could have done it a lot quicker if I needed to.
Okay. And what would that quicker have looked like? Like half the time?
Yeah, probably half the time.
3 months? Yeah. So how many eggs did you expect to get? Or how many did they say, oh, look, you'll probably get X amount? Did they do that?
Yeah, they said that most people get between 6 and 15 eggs.
Okay.
I had 35 mature follicles on my first retrieval.
Wow.
And they retrieved 32 eggs.
Oh my goodness.
But which was really surprising to me. But then speaking to Dr. Lou and the nurses, they said with the polycystic ovaries, I have additional follicles each cycle anyway. So that's probably why they were able to collect so many eggs. And there was a 90% chance of having a baby with 30 eggs. So just to be sure, I went back and did a second cycle and got an additional 29-ish eggs.
Oh, wow.
So not all of them made it to maturity.
Yes,
The embryologist has a look at them after 24 hours and calls you. But a large, I think 80% of them were mature and viable. So
oh my goodness.
I was very happy with that.
So then when does it become a discussion or who has that discussion with you to go, okay, this is above normal?
Yep.
Have you ever thought about egg donation?
So no one actually really discussed it with me. It was more that going through the process myself and sitting in the recovery room at Francis Perry House where I had the procedure done, there were a number of women that were coming out of theatre and sitting in the recovery chairs, and we'd talk and obviously, unfortunately, overhear things. And there were women that were getting no eggs, 1 egg, 2 immature eggs, and it was obviously really distressing for them. And I kind of thought while I was sitting there feeling a little bit uncomfortable, but the procedure really wasn't that bad. The whole thing wasn't as bad as I thought it would be. And I thought, well, if I can manage this and it hasn't completely upended my life, why wouldn't I think about giving someone some of my eggs? Because I seem to have a surplus of them, and these poor women are going through this process over and over again to get 1 or 2 or 4 that might not even be viable. So that's when I just started researching egg donation. And I found the Royal Women's Egg Bank, which is the only free egg bank for women who have kind of exhausted all their financial resources and now need to rely on the kindness, I guess, of strangers to donate their eggs.
Absolutely. I was just about to say, what an incredibly kind, beautiful human being you are, Jess. We speak to lots of women, and obviously we have guests that we care for that have been through egg donation, they have had their children through egg donor, and they have literally spent a decade trying to have children. So thank you for being such an incredible human being.
Thank you.
This is a different realm now in egg donation. Did you have concerns about the process? Was there then a whole other set of rules that you had to go through? Yeah,
there was. So there was a lot of psychology involved. I had to see a psychologist to make sure that I was mentally capable to cope with the idea of biologically being someone's mother but not having any contact with them, and that there would be children out in the world with my genetic material that I couldn't have anything to do with, as well as making sure I could cope with the process of the injections and the medications, which I'd already kind of started that part, with Women's Health. I was also a bit worried about the volume of eggs that they were collecting from me, and if that was going to affect my fertility levels down the track. Am I giving up 35 eggs each time? Is that taking away 35 potential opportunities to become pregnant for myself? But the team at the donor centre are fantastic at the Royal Women's. I can't compliment them enough about how much they explained everything and supported me through it. And they actually explained that every month when you ovulate, I would have been ovulating around that many eggs anyway. One becomes mature, and then all of the other eggs in the ovaries or in the follicles will undergo apoptosis or cell death and be just absorbed into the body, and the 1 or 2 mature eggs will be released through the fallopian tubes into the uterus. So I wasn't actually depleting my ovarian reserve at all. It was just forcing all of the follicles to mature when only 1 or 2 normally would. So that was quite comforting to me, because I thought I'd love to help these women as much as I can, but I don't want to go and completely deplete my own reserve when I don't have any children.
Understandably. Yeah, absolutely. Were there any particular questions aside from what we just talked about? Were there any other sort of questions that you asked through that process?
Yeah, I was interested to know about if the children were ever going to be able to contact me, what the process looked like, and what the laws around egg donation in Australia was.
Yes.
Which is actually, there's no real formal legislation around it.
Of course there's not.
They can contact you after the age of 18, which I was more than happy to. And in the time being, I wrote a letter to the potential future children for the parents to give to them when they find out, or if they choose to find out, just explaining myself and why I chose to give the gift that I did to their parent that have worked so hard and travelled such a long road to try and find them, and that how loved they already were before I just gave them a little helping hand along the way. And the psychologist explained that a lot of the time that letter is enough. It's got some details about me, my life, my heritage, and that's often all the children or young adults are really interested in. They just want to know where their genetic materials come from.
So I'm interested in, so you're 34 now.
Yep.
So what happened, and you may not know the answer to this, Jess, it's so fine. What happens if, say, later on down the track you develop a heart condition or a particular type of cancer, or how does that, do you then have to inform? Is there an obligation of information?
No, there's no formal obligation, but after my eggs had gone through the quarantine period, I do genetic screening, which screened me for over 3,000 different genetic conditions and predispositions to certain illnesses. I don't find out the results to that, which I would have liked to know.
Yeah, no, I so would have loved to as well.
But they would let me know if there was a genetic condition that was going to affect me later down the track. So one is a kidney issue that you don't find until you're normally in your mid-40s.
Yeah, okay.
There's a genetic component to that. So they would have told me if anything like that was picked up. But otherwise, I'm thoroughly screened, and then they compare that genetic screening with the male who's they're gonna mix the egg with to create the embryo and make sure there's no clashes in there that's going to pass down some genetic issues.
Okay. So then who has access to the donated eggs? So for someone that's listening and is like, I feel like I've exhausted all of my avenues, this is my next avenue. Do you know how someone would access?
Yeah, so through the Royal Women's Hospital, it's the public egg bank, so it's the only free egg bank, and it has to be for women who have exhausted other options, or they have medical reasons why they can't use their own eggs or fall pregnant naturally with their own eggs. So women that were born without their ovaries intact or have had surgery that have damaged the ovaries, people that have had cancer and their eggs have been affected by their treatment, and just other people that are unable to fall pregnant naturally due to a genetic problem with their own egg where it's unable to implant and develop. So I think there's a certain number of miscarriages and testing that people, but they would have gone through that anyway after doing their own IVF journey.
Yeah,
so there is a criteria. It's not overly strict, but there's unfortunately a 4-year wait. So families have to be pretty at the end of, all of their options before they go to that. There's nowhere near as many donors as recipients waiting. So.
Yeah, I would imagine so. Okay, I just want to go back a bit because my brain's like, oh my God. Did you yourself experience any side effects through this process?
Not particularly. I guess, well, yes and no. Because they retrieved so many eggs from me, I had kissing ovaries, which are where my ovaries are so engorged because the follicles are so
Oh
big
my
that they're rubbing
goodness.
against each other in my
Oh,
pelvic cavity. So I was uncomfortable and bloated, but I could still go to work. I wasn't like throwing up and
okay.
in pain all the time. I was just a bit bloated and uncomfortable. And then I had, I guess, some pregnancy symptoms because your body thinks it's pregnant because they're suppressing ovulation. So I had like sore breasts, sore
Yeah.
lower back, that
Yeah.
kind of thing. A little bit of nausea, but again, nothing
Yeah.
to really impact my day-to-day life.
Are there any other testing or requirements that donors, so again, on the other side, if someone's listening to this thinking, I don't want to have children maybe, but I've been told that, in whatever form, and they are thinking about donating their eggs, what are the general testing or requirements? So we've talked about the psychology element of it, the genetic testing.
Yeah. And then the same as when I did my own retrieval. So they do full blood serology for like your sexual health, your making sure you don't have anything like HIV, chlamydia, anything that can affect the reproductive organs. And they just have to be between the age of 22 and 35, otherwise healthy. So
Okay.
Yeah.
So 22 and 35. So anyone out there who's between 22 and 35 and wants to give the gift of their eggs, please consider it. Do they limit how many of your eggs they give out?
Yeah, they actually do. So that's really the only law that I had to abide by when I was donating my eggs. You can't start more than 10 families in Australia. So I can donate my eggs to 9 families and reserve a spot for myself. But it's actually punishable by like jail time if you go and, I guess we've all heard about the Netflix series and things. We just go and spread our genetic material all over the world. So I had to sign a contract, an agreement that I wasn't going to donate to any other donor services because there's no universal record either of who's donated eggs where.
Yeah, because I was going to say, how would they even keep track of that?
Yeah, they can't. It would just be if someone stumbled across it, it came out some way. So I picked the number of how many families I would want to start, and it was anywhere from 1 to 9 or 1 to 10 if I didn't ever want to have a family myself.
Right.
And I said, depending on how many eggs you get, I'm happy to go the full 9.
Bless you.
And then they give each family a certain number of my eggs. So it's not just 1 egg per family or per woman. I think it's between 8 and 10. So they get a few goes. And then if they want a biological sibling, they can have those eggs on the side just in case they want to have a second go. And
so how many eggs in total did you end up donating?
I've donated about 60 eggs.
Wow.
So, and I think that's probably it for me. I'll be 35 next year anyway.
Were you told through this process that you were on the higher side of egg generation, if that's even a word or a term?
They called me a super egger.
Yeah, I was going to,
Yeah. So, which again, they put down to the polycystic ovaries and the extra follicles each month that haven't really given me too much trouble, but now as a result have been a big gift to lots of people.
Oh, wow. How amazing. Do you get notified when your eggs are donated or used?
Not when they're used, but if there's a live baby born, I get told that there's been a baby boy or a baby girl born and when they're born, but I don't find out any other information.
Okay. Have you been notified?
No, not yet. It's only been about 6 months, so
okay. How do you think you'll feel?
Months. I think I'll feel really proud or happy that because I've seen how much joy my niece and nephew have brought into my family's life, and not just my brother and his wife, but my whole extended family, and how much love we all have for him, and how it's changed the dynamics of our family. So I think I'll be quite almost a bit teary and feel proud that I can't believe that someone gets to experience that love, and it wouldn't have been possible without people donating and helping out, and that maybe this long journey that's probably felt quite hopeless for a long time has ended in such a joyous occasion, so that they're going to be able to remember for the rest of their life. So I think I'll be quite proud.
Absolutely, and so you should be. It's just the most incredible, incredible gift. I think when we think about sperm donation, like I said before, it's such a throwaway. It feels like such a throwaway thing that men do, and it's almost it almost feels a bit dirty, sperm donation.
Yeah.
But this conversation, I feel like, has brought such a different aspect and light to what egg donation can be about.
Yeah.
Like, it's just incredible. There's so many more questions that I could ask, but we'll leave it there today, Jess. Thank you so much for sharing. I really want to know when you get notified now.
Well, I'll have to tell Rachel.
Yes. Tell producer Rach. Yeah. And, I'm sure our listeners would love an update as well of when there's another little biological Jess in the world. Yeah. Thanks again, Jess.
Thank you very much for having me.
This podcast represents the opinions of our hosts and their guest speakers. Views and opinions expressed in the podcast are our own and do not represent that of our places of work. This podcast is for informational purposes only, and content here should not be taken as medical or professional advice. Please consult your healthcare professional for any personal recommendations and medical care. While we make every effort to ensure that the information we are sharing is accurate based on the best available information at the time of recording, we welcome any comments, suggestions or feedback via our website contact form, home.com.au/contact. Names and details of personal experiences may have been changed to allow for anonymity and privacy. To join the conversation, join us on social media at Home Postpartum.